when you have liver cancer, when a patient comes to us with a liver cancer, we should look at two groups. They should divide them into two groups. One is curable liver cancer. That means in these group of patients, we are actually trying to completely remove the cancer and give them a permanent cure. And incurable liver cancer, that means these patients are far too advanced disease to achieve a permanent cure. So we're just trying to prolong their life or decrease their suffering. So in case of a liver cancer, when a patient comes to us, unlike other cancers, we're just looking at the cancer per se, the stage of the cancer, the type of cancer, the aggressiveness of the cancer, the extent of its spread. In liver cancer, we have to look at two dynamics. One is the factors related to the cancer. The other important thing is the factors of the liver disease. So like I said, the liver cancer usually occurs in patients with underlying liver disease. So we need to look at the the severity of the liver disease. The liver disease, we classify it into child stage, child A, child B, child C, or we have a MELD score. A MELD score goes from 6 to 40. So what is the particular status of the liver function? What is his child status? Based on that, and also the stage of tumor, both these factors we consider while treating the disease. That's why the treatment for liver cancer is highly specialized, and it should not be done at the routine sort of cancer centers which treat breast, limb and intestinal cancers. The liver cancer treatment should be done by a multidisciplinary team which has an expert liver surgeon, a GI oncologist, medical gastroenterologist and a hepatologist, and an interventional radiologist. So this entire multidisciplinary team should be involved in the decision making and the care of the liver cancer patient. So patients with curable liver cancer, depending on very complex dynamics of the tumor stage, the liver function and the patient's general condition, the options we have are surgery, in which we remove a part of the liver bearing the cancer. Then ablation. Ablation means that when the liver function is not so good, so that the patient may not tolerate that you can remove that part of the liver, the patient may not tolerate that surgery, but the tumor per se is small, less than 5 centimeters, less than 3 centimeters sometime. We don't need to remove the tumor, we need to completely destroy the tumor by various thermal energy. So the options we commonly use are, one is radiofrequency ablation, in which we use radiofrequency energy to ablate and burn the tumor, and we use microwave ablation. So for specific tumors, small tumors, the microwave or radiofrequency ablation treatment results may be as good as surgery. Though surgery is still the best option if the patient's tumor and the liver function and the patient's general condition dictate that patient can have surgery. Surgery is still the best option, but in selected patients, because of poor general condition or the deep lying tumor, if they're not able to tolerate surgery, for some early tumors like less than 3 centimeters, less than 5 centimeters, the radiofrequency microwave ablation give results which are actually equally good. And for some group of patients with underlying severe liver disease like hepatitis B, C and NAFLD, if the liver function is also poor and in addition they have a liver cancer, a liver transplant is a good treatment for liver cancer patients. So again, we need to select a specific liver cancer patient. Not every liver cancer patient can be treated with a transplant. Only selected early cancer patients in whom the tumor is limited to the liver, it's not spread beyond the liver, and there are some specific criteria we have, like Milan's criteria, UCSF criteria, tumor size should be less than 5 centimeters, and some other biological and the imaging characteristics of the tumor. Once we select carefully based on these characters, these selected patients can do very well with transplant. The advantage of transplant is it does two things. It cures not just your cancer, but it also cures your underlying liver disease. So especially in patients who are having a very aggressive and advanced liver disease, in those patients, the transplant will tackle both the problems in one go. So most of the time, unfortunately, in our country, we do get patients with a lot of incurable liver cancers, patients in whom the tumor is too advanced for either surgery or transplant or microwave ablation. In these kind of patients, what are the options we have? So for the routine liver cancers, people talk about chemotherapy and radiotherapy. Like I said, liver cancer is a very specialized tumor which is totally different from your routine cancers. So your regular chemotherapy and all don't work at all for liver cancers. So what do we do for advanced liver cancers? We do treatments like TACE, transarterial chemoembolization, or transarterial radioembolization. So in these patients, unlike the routine chemotherapy in which we give it into the veins and the chemotherapy attacks the entire body in addition to the liver cancer, in these kind of patients we actually put a catheter through your groin, to the groin area into the femoral vessels. We go actually the catheter goes up till the tumor, and the blood supply to the tumor is blocked, and then chemotherapy is delivered to the dying cells. So that cells are actually, you block the blood supply to the tumor cells, and when the cells are dying, you actually sort of give chemotherapy, because the chemotherapy acts much better on the hypoxic cells. Only this kind of chemotherapy, specialized chemotherapy, works for liver cancer. Your routine systemic chemotherapy does not work for liver cancer. So this chemotherapy can be done by TACE, transarterial chemoembolization, in which we block the tumor as well as give chemotherapy such as doxorubicin delivered directly into the tumor cells, or we can do it by radioembolization, in which we block the tumor cells and deliver the radiotherapy by something called special yttrium microspheres, deliver the radiotherapy through the tumor cells. In patients who don't have, in whom the liver cancer is far too advanced for even TACE or TARE, so in, like, for example, patients in whom the tumor is spread beyond the liver into the bones and to the brain or into the lungs, in these kind of patients also, your routine chemotherapy which we give for other in the regular cancers does not work for liver cancer. Like I said, the liver cancer is a very specialized cancer. In these patients also, we have specialized chemotherapies such as targeted chemotherapies. Targeted chemotherapies are basically, they specifically block one aspect of the tumor metabolism, like tyrosine kinase inhibitors, and they control the tumor. So in liver cancer, we have targeted therapy like sorafenib or sunitinib and these kind of specific chemotherapies, which are given in an oral form daily with minimal side effects, and they prolong the life of these patients with advanced liver cancer.